This presentation is about veterans and substance misuse and is presented by Sierra Miller and Riley Brasher. With veteran misuse rates versus other populations, more than 1 in 10 veterans report a substance use disorder. This is nearly 900,000 the population in the United States. Alcohol is reported to be the primary substance for around 80% of veterans are reporting alcohol misuse. 27% of veterans report illegal and prescription drug use, with marijuana being at 11%, heroin nearly 11%, and cocaine use being around 6%. Uh, 7% of veterans report both alcohol and illegal substance use. It's found that male veterans are twice as likely to develop a substance or alcohol use disorder than female veterans. Sixty percent of veterans who report having post traumatic stress disorder also report having a substance use disorder, as it's been found that there is a strong link between trauma and a substance use disorder. 20 to 25% of veterans report mental health concerns. It is found that with mental health challenges, there can be a significant increase in the risk of a substance use disorder or alcohol use disorder, as many veterans turn to illicit substance use as an attempt to self medicate after experiencing any of the traumatic events. 41% of the homeless veteran population report having a substance use disorder. It's found that substance use disorder is closely tied with those suffering from housing instability. Many veterans turn to alcohol or an illicit substance as a way to cope with the traumatic events that they experienced while serving, or to help with adjusting to the new civilian lifestyle. Many veterans also report having chronic pain, with nearly 41,000 veterans being addicted to painkillers. Hydrocodone is reported to be the most common prescription drug that veterans are likely to misuse.
When examining substance misuse among veterans, it's essential to begin with the broader context of social determinants of health. These are the environmental and structural conditions that shape an individual's daily life and overall well being. For many veterans, the transition from military to civilian life can significantly disrupt these determinants. One major factor is housing instability. Veterans are disproportionately represented among individuals experiencing homelessness, and unstable housing environments can increase exposure to substance use while also making recovery more difficult. Employment is another key determinant. Many veterans struggle to translate military skills into civilian job markets, which can lead to underemployment and or financial stress. This financial instability can in turn increase vulnerability to substance misuse as a coping mechanism. Access to healthcare is also critical. While services are available through the U.S. Department of Veteran Affairs, barriers such as long wait times, eligibility requirements, and geographic distance, especially for those in rural areas, can limit. There are also specific risk and protective factors that influence substance misuse among veterans. Understanding these helps guide more effective and targeted interventions. Starting with risk factors, trauma exposure, is one of the most significant. Many veterans have experienced combat related trauma or military sexual trauma, both of which are strongly associated with substance misuse. These experiences often contribute to co occurring mental health conditions such as PTSD, depression, and anxiety. Substance use may develop as a way to cope with intrusive thoughts, emotional distress, or sleep disturbances. Chronic pain and physical injuries are also common among veterans and can increase the likelihood of prescription opioid use, which may lead to misuse or dependence. Another important risk factor is the transition out of military service. This transition often involves a loss of identity, structure, and purpose, which can create emotional distress and increase vulnerability to substance use. Stigma also plays a major role. Within military culture. Seeking help is sometimes perceived as a sign of weakness. This can delay or prevent veterans from accessing treatment, allowing substance use issues to worsen over time. At the same time, there are several protective factors that can support recovery. Strong social support systems, including family members and fellow veterans, are critical. Peer support, in particular, can be very effective because it helps foster trust and shared understanding. Access to integrated care through systems like the U.S. Departments of Veteran Affairs also improves outcomes, especially when mental health and substance use are treated together. Additionally, many veterans possess high levels of resilience, discipline, and adaptability due to their training. When these strengths are leveraged in treatment, they can significantly support recovery. A renewed sense of purpose through finding employment, getting education, or being involved in the community is another powerful protective factor that helps reduce the risk of ongoing substance misuse.
For barriers to treatment, the first could be a stigma or cultural beliefs, with stigmas being that seeking treatment could make them be seen as having weakness or being a failure. They may fear that they are seen as damaged goods, may avoid treatment due to having internalized shame about suffering from substance or alcohol use disorder. They may be worried about how peers and those in leadership positions will view them for seeking treatment. With cultural beliefs, there are some cultures that associate addiction with intense shame. They see it as a personal or a family weakness. This belief can lead to secrecy, which can limit access to treatment, as families might fear that they will lose social standing within their society. A second would be a lack of awareness or trust. Veterans might not know that there are resources available to them and may not know where to start looking for them. They could be suspicious of treatment and if it would work for them. Veterans also might fear that civilian providers would misunderstand and misinterpret their traumatic experiences that might have led to a substance use disorder, and fear that admitting that there is an issue could ruin future careers and their reputations. A third thing would be financial issues, with even though some veterans may have military or VA benefits, there might be extra costs in treatments, also medications and travels for long distance treatment facilities. Even though VA will cover majority of the cost of treatments, there's also some gaps in coverage, lack of nearby facilities, and a high cost of private facilities that might prevent veterans from seeking any treatments. A fourth thing would be rural areas, as there are many less populated areas that have less access to treatment in comparison to those more urban, more populated areas. Some veterans might also have transportation issues for those long distance appointments that might make it hard for them to seek any treatments or to get to and from treatments. A fifth and final thing would be a fear of consequences, as they may have concerns about confidentiality and if what is said in treatment really stays within those walls and with the facilitator. There may also be a fear that they could lose their current position or that seeking treatment would have an impact on their current career or any future careers that they might seek. There's also the fear that they could lose any current military benefits, future VA benefits, or any security clearance that they presently hold. There's also the fear that they would lose trust in their peers and any commanding officers or those in higher positions, as they might see that they are not fit to oversee certain projects.
When considering recommendations for best serving veterans experiencing substance misuse, it's important to focus on both direct clinical strategies and broader policy level changes. Together, these approaches help address both individual needs and systemic barriers. Starting with strategies to support veterans in practice, trauma informed care is essential. Many veterans have experienced combat related trauma or military sexual trauma, and these experiences often underlie substance use. Trauma informed care means creating environments that prioritize safety, trust, and empowerment while also recognizing how trauma impacts behavior and coping. This approach helps reduce re traumatization and improves engagement in treatment. Crisis and peer support programs are also critical components. Veterans are often more willing to engage with individuals who share similar lived experiences. Peer support specialists can help build trust, reduce stigma, and provide a sense of connection that may be missing after leaving military. Crisis services, especially those tailored to veterans, are essential for addressing acute mental health and substance related crises, including suicide risk. Increasing screening practices is another important strategy. Routine screening for substance use, PTSD, depression, and suicide risk allows for earlier identification and intervention. Using standardized evidence based screening tools can help ensure that concerns are not overlooked and that veterans are connected to appropriate services as early as possible. Additionally, providing low barrier access to care is key. This includes reducing requirements that may prevent veterans from seeking help, such as complicated intake processes, long wait times, or strict eligibility criteria. The goal is to make it as easy as possible for veterans to enter and remain engaged in treatment. At the policy level, several changes can further improve outcomes. Expanding telehealth services is especially important as many veterans live in rural or underserved areas. Telehealth increases accessibility and allows veterans to receive care without the added burden of travel or transportation barriers. Reducing structural barriers is another major priority. This includes simplifying systems of care, improving coordination across providers, and addressing limitations related to discharge status that may restrict access to services through systems like the U.S. Departments of Veterans Affairs. These barriers can prevent veterans from receiving the care they need, even when services are technically available. Finally, increasing outreach efforts is crucial. Many veterans who struggle with substance misuse are not actively engaged in care. Proactive outreach through community programs, partnerships, and veteran specific initiatives can help identify individuals in need and connect them to services before issues escalate. Overall, effectively supporting veterans requires a combination of trauma informed care, accessible and culturally responsive care, along with systemic changes that reduces barriers and expand access to treatment. Thank you.